Hello, my name is Monika. I'm from Rwanda. I've had an issue of blood clot for 3 years. The symptoms that I had difficulty in breathing, which made me to be hospitalized back there home. And for 3 years, I've been trying to look into this issue of blood clot to understand what it's all about. I came to Medanta to seek for further investigation on my disease. So I got to know about Medanta through my brother James. He connected me to another person who represents Medanta in Rwanda. This person helped me get papers. When I came to Medanta, they really took good care of us. They helped us get doctors. They booked appointment for us. The first doctor that I met was Dr. Visek Singh. He's in charge of respiratory diseases and sleep medicine. From there, I had to meet many doctors, including a cardiologist, Mr. Anil Ban. I also met the chest surgery, Mr. Bin Asaf. They all took me in. They helped me understand that from my disease, I had other underlying issues, which they had also to take care of. From that, I had to meet other doctors. Dr. Preeti, she really took good care of me. She helped me understand the issue that I had, and she took me step by step of what I need to do. Right now, I feel I'm okay because I've learned what my disease is all about, and the symptoms that I had has shown that it was really blood clots, and from the test that I did, I have been told I will live with this disease. So I have to take good care of myself. I have to take my medicine religiously, and I have to always consult my doctors when I see some changes. So I would like to thank the IPS department. They also took good care of us. Anytime we needed help, they were there for us. Anytime we called them, they would help. So thank you, IPS department. Thank you, Medanta.
So this patient, Monika, she actually traveled from Uganda, and when she came, she was suffering from heavy periods, and the ultrasound showed that she had small multiple fibroids. Along with that, in her medical problem, she had a history of DVT and pulmonary embolism, for which she was on blood thinner. So this was quite major medical problem which was restricting her to get the proper treatment. She actually wanted to have a hysterectomy, but then because of her medical history, she was at a very high risk for further complications like bleeding and aggravating the pulmonary embolism. So we discussed the different options, and then we decided that for her heavy periods and multiple fibroid, the less invasive option, which is a hysteroscopy and insertion of Mirena, is going to be beneficial because it is going to cure her from her gynae problem. At the same time, it's going to be less risky than doing a very major surgery. So in collaboration with the anesthesia department and our vascular surgery department, we changed her anticoagulant medicine on injectable. So 4 to 5 days overlap is required. And then following that, we did this procedure under general anesthesia. And then 3 to 4 days later, the injection was again switched over to the tablet, and her INR was maintained within treatment range. So now 5 to 6 months later, she is quite happy and her symptoms have improved. And this shows that if we consider the medical history and try to see what least invasive treatment can be done to treat these patients, it can really help them.